Hi, this is Dr. Joseph Witt-Doerring. The purpose of today's video is to talk about why do only some people develop protracted benzodiazepine withdrawal and others are okay. And it may be useful to start this video with some anecdotes. Back when I was a trainee and I trained at Baylor College of Medicine in Houston, um, I frequently saw people coming into the inpatient units who were benzodiazepine users. They might have been on, they actually wouldn't even know. They could have been on huge amounts. They would be buying benzos off the street. Maybe it was laced with fentanyl, but they would essentially be getting what their dealer would be giving to them. It could be anything from a half a milligram of Xanax to maybe 2 milligrams, but who really knows? There wasn't that much quality control. And so we might have people come into our inpatient units taking maybe 5 or 6 of these a day for a period of several months or so. They would come in, we'd have absolutely no idea how much they were on, except that it was a lot and they were highly dependent on it. And over the space of about 2 weeks, we would rapidly have them taper down to about maybe like a milligram of Xanax, sometimes even just on gabapentin, and then they were out the door. And these people were okay. None of them developed significant tinnitus or the constellation of symptoms that is now known as protracted benzodiazepine withdrawal. So I thought it might, and this was fairly common. I saw this several times at different hospitals. So protracted benzodiazepine withdrawal is not something that everyone will get. In fact, I believe it's quite uncommon just from working at a lot of different hospitals and seeing a lot of people on benzodiazepines. So I think the first thing to talk about is that there are likely genetic and very personalized reasons why people develop this that are unknown. So I'm going to speculate a little bit as to what makes sense to me as the mechanism behind all of this. So your brain does not like external chemicals coming in and changing things. So if, say, for instance, you start taking Xanax or Klonopin and you have it in your brain after all, for several months, it is affecting the GABA system. And what we know about the GABA system is that it is the primary inhibitory neurotransmitter system in the central nervous system. And so it's not a system that's just involved in anxiety or sleep. It is involved in everything that your central nervous system, also, your brain does. And so if you start putting an exogenous substance, a Xanax in there to start stimulating that receptor, you will induce a cascade of adaptory changes over time, because your GI system, all of, your cardiovascular system, all of these different systems in your body that have been relying on a fairly typical consistent tone, inhibitory tone and excitatory tone, they are now off balance because we have this external agent coming in that is really stimulating the GABA receptor a lot, causing global inhibition. So over time, the other neurotransmitter systems ramp up. This is serotonin, norepinephrine, dopamine, glutamate, to push back against these changes to keep the other systems in your body working as they ought to. Over time, and now this is where the speculation comes in, it is a possibility that this is not, these changes can create an unhealthy neurochemical environment in the brain. And it is possible that maybe, because you have so much GABA, now we're compensating with a lot of upregulation of the other neurotransmitter systems, that you could create an environment that could be neurotoxic. This is an environment where there could be neurological damage, neuronal damage, and that might result in the symptoms of, tinnitus or sensory pain, muscle twitches, things like that, symptoms that don't go away after the drug is stopped. So they're suggestive of neuronal damage. Why this only occurs in some people is it's not really known. But this is also something that can happen without factors which we typically attribute to being the cause of protracted withdrawal, such as abrupt drops in your medication. We see some patients who just develop this gradually while they are on the drug. Sometimes they confuse it for interdose withdrawal symptoms, but really what they're developing is a neuronal toxicity, which is a result of the adaptory changes in the brain that have happened by being on prolonged benzodiazepines. Okay, so that's the first part. There is some people who just appear to be susceptible to these to this neurotoxicity after the drug has been in their system for a long time. Other things that can trigger the benzodiazepine protracted withdrawal are sharp drops in medications. So if you are taking Xanax, you've been on it for several years, and all of a sudden your doctor says, I'm not going to prescribe it for you anymore, and they taper you over 2 weeks, and it's really quick, and maybe they don't adjust back, maybe you're feeling terrible, and they just go, no, you just need to push through it. We're going to try an SSRI for your anxiety. In situations like that, when people are abruptly withdrawn, that can sometimes be the straw that breaks the camel's back, because all of a sudden, there's nothing to push back these years of push back against the excitation in those adaptations that you've built up over time by being on the drug. You've upregulated serotonin, noradrenergic, dopaminergic tone, glutaminergic tone to push back against the presence of that benzodiazepine. Now it's unopposed, and it can just cause so much excitation, and that excitation, especially when it's at that level, could be damaging. And that's why a lot of people come to us after they've had these acute drops, and that's typically the story. They had an acute drop, and then they got back on the medication at the same dose, and it's still there. That was the trigger that caused neuronal damage. Another thing that's a little bit more rare, but we're seeing more and more, is people going to emergency rooms, getting treated with fluoroquinolone medications like ciprofloxacin for UTIs or other types of infections. These medications are agonists at the GABA A receptor, and what they can do is displace the binding of your benzodiazepine. So it's almost like you stop taking it. You had a cold turkey withdrawal because they take the spot where usually the Xanax binds to the GABA receptor. And that's another thing that causes this neurotoxicity, acute neurotoxicity, and then afterwards, after the treatment's over, it doesn't go away. And that's really what we're thinking is happening there. So what should you do if you're on a benzodiazepine and you want to do your best to make sure this doesn't happen to you? You need to find a provider that can work with you on a very flexible, patient-led tapering program. Someone that can lead you through a taper in a very gradual and slow way. And that's really the best thing that you could do to avoid this. So I hope this video was helpful, and I appreciate you listening. Thank you.